Hello students, welcome to Dr. B.R. Ambedkar Open University. Today we are going to know about the evolution of hospitals and types of hospitals. So, what is before we begin into the evolution of hospitals and the history of hospitals, let's know what is the definition, what exactly is hospitals. So according to WHO, it is an integral part of the medical and social organizational objective of which is to provide for the population complete health care, both curative and preventive, and whose outpatient services reach out into the family in its home environment. The hospital is also a center for the training of healthcare workers and for biosocial research. In simple terms, a hospital is a healthcare organization or an institution involved in preventive, curative and ameliorative, palliative and rehabilitative services. So, what is the history of hospitals? The earliest history were in worship places. You might have seen in many movies and series and other things. In ancient history, hospitals were treated. There were no particular hospital structures or organizations. People were treated in temple places because treatment was also considered as a worship. So, healing and care for sick were an integral part of worship places in Greek and Roman civilizations. Ancient hospitals. Hospitals were established by King Ashoka in India, coming to our country. So, in 2030 BC, and Minhintal hospitals and other centers under Sinhalese royalty in 6th century AD, and Academy of Gondishapur, Iran, first medical school in 4th century AD. The first formal hospitals is a Hôtel Dieu, Paris, founded by Saint Landry. It started as a charity to provide food and shelter to the sick. Basically, some of the old hospitals on record: Saint Bartholomew's Hospital, London, 1123 AD; Hospital de San Lazaro, Mexico, 1524 AD, and few others. Modern era of hospitals growth. By mid of 19th century, there were good number of hospitals, mostly run with public funds across continents. A rapid growth of hospitals happened between 1860 to 1920. Rapid advancement in the field of medicine, growth of nursing care as a profession, considering acute care as important. Now consolidation period 1920 to 1950. From being a not-for-profit organization, hospitals grew to be for-profit organization. As gradually time changed, everything has changed. Non-profit organizations, non-profit healthcare centers has become or advanced into profit organizations. American College of Surgeons were constituted in 1913. It was the initiative of Franklin Martin, MD, FACS. The college is a surgical society which is dedicated to promoting the highest standards of surgical care through education of and advocacy for its fellows and their patients, and to safeguarding standards of care in an optimal and ethical way. Practice environment. Hospital standardization program developed by ACS was later taken over by JCAHO. So, what is modern hospital era? An Indian perspective. Pre-independence. Let's consider this pre-independence and post-independence. So now, the history of Western medicine in India dates back to 1600, when the first medical officers arrived in India along with the British East India Company first fleet ships surgeons. The medical department was established in Bengal as far back as 1764 for rendering medical services to the troops and servants of the company. So, before the East India Company occupancy and before the independence, the first hospital or the Western or the Western medicine came to India this way. Before that, we all have no idea about the Western medicine. We all used to follow preliminarily the Ayurvedic, which was an ancient Indian medicine for us. So, we used to follow that. But after the occupancy of the East India and the establishment of the East India, the Western medicine has first landed in our country. In 1785, medical departments were set up in Bengal, Madras and Bombay presidencies with 230 for surgeons. The medical departments involved both military and civil medical services. In 1796, hospital boards were renamed as medical boards to look after the affairs of the civil parts of the medical department. In 1896, 3 presidential medical departments, civil medical department, public health commissions, statistics office were amalgamated to form the Indian Medical Services, that is IMS. Now, post-independence, this was all the work that was done before the independence, but what happened after the post-independence? At the time of independence, there were 7,400 hospitals and dispensaries in 19 medical colleges, no match to the growing population. Various committees were set up to study the need and make recommendations. The number of beds were 0.25 by 1000 population at the time of independence, and by 1995 we could achieve a ratio of 0.67 beds by 1000 population. Now, committees. What are the important committees that has contributed for the growth of hospitals? Bose Committee 1946, setting up of PHCs. And Mudaliar Committee 1962, create an all India health services similar to Indian administrative services and strengthen existent primary healthcare centers. Jain committees. This was established in 1966, 1 bed per 1000 population, and enhancing maternity facilities at each level, provision of health insurance for larger population coverage. BRAOU Committee 1968, appointment of medical audit committee for each hospital. Srivastava Committee 1975, create a new brand of health auxiliaries. And now Sidhu Committee, Rajan Committee, Bajaj Committee, these are some among the committees which were also important. Changing concepts of hospitals. So, trustship period. What is this trustship periods? Medical sciences was not much developed. Hospitals were charitable and managed by trustees. Now, physician period. In this period, new medical technologies started evolving, doctors became focused, private nursing homes were established. Administrative and term period. These hospitals became larger, administration gained importance, and paramedical fields gained importance. Then comes the final and present era, that is corporate sector period, effective of globalization on healthcare, larger hospitals, faster advances in healthcare technology. So, what are going in depth with the changing concepts of the hospitals from trust period to the physician period to the administrative team period and cooperative sector period. What are the changes that we have seen? Earlier in the trust period hospitals, because the healthcare was expensive in those economically backward phases of India, the medical sciences, or which was considered expensive, which was considered rare for the reach of every population, this were managed by the trustships. Like even now we can see the Tata Trust hospitals and other trust hospitals, Satya Sai Trust hospitals. All these hospitals, they were established by the rich and the royals to help the poor and to provide the healthcare for the population of those areas. Hospitals were charitable and managed by trustees, which are even there even now, but not so many. Now coming to the physician period. So, where we can see where the medicine has developed in India, we have seen the growth of doctors in India, where the study of medicine was opted by many populations, education evolved, and we can see physicians here and there, and that was the era of the physicians, where we can see small nursing homes, here and there, the medical practitioners individually, doctors became the focus, and the private nursing homes were also established by the doctors who have the capacity to establish a small scale hospitals. Then came the importance of the administrative and the team period. Hospitals became larger and administration gained importance, paramedical fields involved, like adding feathers to the healthcare. Earlier it was just the physician taking care of the patient. Then in this phase, administration gained importance, paramedical, other options like physiotherapy, paramedicals, all the other aspects of the healthcare were also added as a feathers to the health, primary basic healthcare system, and it was enlarged. Now that complete enlarged or evolved system has taken a structure where multiple teams, multidisciplinary departments involved and formed a proper structure, that is corporate sector period.